So another question I've got is, when do I need therapy and when do I need medications? Well, sometimes one is only in one or the other, and sometimes both. So so someone might say, see, if it's a clinical problem where I can tell it's a clinical depression, a clinical anxiety, or clinical bipolar, whatever, that's a medical chemical thing that I treat. Now, I'm not a psychologist, even though a lot of people think I'm a therapist because I'm a good listener. I spend a lot of time with people. And some people actually book appointments with me just for me to talk to me. And I, even though they know I'm not a trained therapist, they say you listen and you care. So I do what I do. My job is medications. That's what I do. Therapists are important. I work with many of them. Therapists are important if you have stuff in the past that you really need to resolve. This could be anything from childhood trauma. There's a lot of childhood trauma. There's a lot of abuse that goes on, a lot of neglect, abuse, sexual abuse, physical abuse. A lot of stuff that has really severely impacts people. So that stuff really needs to be taken care of and looked into. Stuff that's situational happens, relationship stuff. So divorces, relationship issues. Sometimes therapy is helpful for that, to help resolve relationship conflicts. Doesn't work for everybody. So therapists can definitely help if there's stuff to resolve, if there's specific things that need resolving, and so, there's like cognitive behavioral therapy is basically a very rational kind of a therapy, kind of getting to the rational basis of people. But there's different kinds of therapy. There's exposure therapy for people who have fears of plane rides or whatever, getting in front of a crowd and speaking, which is the most common. So, and also situations like, let's say, you lose your job and you fall into you're really sad about it. You can't find a new job. So a lot of people get really stuck because they're depressed about the job. They're depressed they can't find a job, and so medications can help that for sure, but therapy can help that too. So anything situational that people are having a difficult time dealing with or learning, these are all things that the therapist can help with. And sometimes just even going for a few visits and seeing what they're about, and asking them, what can you do for me? Well, how can you help? How can you help more than what the medications do? They'll tell you what they can do and what their goals are would be with you. So like I said, if you want a good one, I know really good ones. So who work with me and refer people to me, I refer to them. Because therapists, a good therapist and therapists I've worked with over the years know what I do. A good therapist is one who understands that you can't out-therapy everything. Therapy only goes so far. It often doesn't work. It's worth a shot often, but sometimes it doesn't work, and sometimes it works great, and sometimes it works partially, like anything. But if you can get what you can out of it, but then you get to the point where I'm not really getting any more out of it anymore, well, then that might be time to stop. And so, but anyway, that's kind of the basic. There's EMDR, which is a really interesting therapy. It has to do with eye movement and the right brain versus left brain, but it's a very specific type of therapy for PTSD and trauma. Very effective for that. So there's, so these are some of the basic types of therapy out there. Now there's therapy with ketamine. Some therapists now work with ketamine. They work with psilocybin, which is the mushrooms. So now there's newfangled things where they're starting to incorporate certain drugs into the therapy, like ketamine and psilocybin, and so that's kind of blossomed recently because of now that things are becoming a little bit more legal and a little bit more accepted. Anyway, so that's pretty much the basics of counseling. There's other kinds also, but that probably is. Probably a psychologist would be a better source of that than I am, because that's not what I do, like I said. So anyway, hopefully that helps clear things out.